Hello everyone, welcome to my presentation. My name is Elizabeth Herbal. I am in the education track. I will be discussing the implementation of residency programs in long-term care. So about a year ago, I transitioned from working in acute care to working in a management role in long-term care. And I witnessed and heard nurses speak about how they had difficulty transitioning from education to practice. And as a nurse educator, I want to support and educate nurses and to help them be successful in practice. And that is how I developed my PICO question. In long-term care new hire nurses, how does implementation of a nurse residency program compared to no implementation of a nurse residency program improve retention rates of new hire nurses after the first year of nursing practice in long-term care? So the population is new hire nurses, more specifically nurses that are new graduates or have less than a year of experience. The intervention is the implementation of the residency program. The comparison group is the current practice, which is not implementing the residency program, and the expected outcome would be improved retention rates, and the time frame would be within 1 year. So some of my research that supports the implementation of residency programs is, the first one is Eckerson, and she spoke about the Institute of Medicine report in 2010 that supported the implementation of residency programs in acute care as well as other settings, as residency programs improve patient outcomes and patient care by improving the nurse's skills. Eckerson and Salmond and al. Supported that the implementation of residency programs benefits the facilities financially. Eckerson and Cadmus and al. Supports that the knowledge and growth of a nurse improves with residency programs. According to Salmond and al., which is focused on long-term care residency program, states that residency programs in long-term care improve patient outcomes and quality measures such as falls, pressure ulcers, and infections. Continuing on with the evidence-based research process, the database that was searched for evidence includes EBSCO, ProQuest, CINAHL, PubMed, Cochrane, and Medline. However, most of the articles came from EBSCO, ProQuest, and CINAHL. Key terms used to search include nurse residency programs, long-term care, acute care, new graduate nurses, new hire nurses, nurse satisfaction, nurse retention, and cost. According to Pollitt and Beck, medical subject headings, or MESH, help relate topics together. So the MESH topics with this research process included geriatric nursing, education, health services, long-term care, program evaluation, and medical and nursing sciences. The inclusion criteria for the articles to be included in the evidence for residency programs, they had to be peer-reviewed and less than 8 years old. I originally started with a smaller time frame, but determined that I needed some more supportive evidence with a larger time frame. So the articles listed here, brief information about them. Cadmus and Salmond were both focused on long-term care, one on retention and developing a model, while the other was on retention and job satisfaction, and it was the implementation of that model. It also discussed financial aspects of implementation, and the limitation to that one is that the residents consisted mostly of young minority women and RNs only. The systematic review by Eckerson focused on reviewing articles that supported acute care and long-term care residency programs. The strengths of it included that it evaluated 3 of the supporting articles and financial aspects. So 3 of the other articles I'm using as evidence. The Van Camp and Chappie article was a systematic review of acute care, and it focused on retention and job satisfaction as well as financial aspects. However, many of the articles it included did not discuss retention rates at 1 year, which made it difficult to perform the review of retention. The last article listed is Welding. It's a cohort study of an acute care, and it goes over nurse competence and turnover, as well as financial aspects. And the limitation is it only addresses BSN nurses. Most of the cohort studies have small sample sizes. However, according to Pollitt and Beck, a small sample size can be appropriate with limited variations of data. In long-term care, you have limited variations in patients and situations. So in that case, it is appropriate for a small sample size. The model and framework used for the development of the plan and research included the 7 steps of evidence-based practice by Melnick and al. That assisted with the research process from the spirit of inquiry to the dissemination of research findings. To implement the program and develop the plan, Patricia Benner's model of skill acquisition described by Murray and al. Was used, because that model represents the building of knowledge based on more experiences received by the nurse, of which a residency program would increase the experiences the nurse receives. So to discuss the integration, the CCNE Nurse Residency Program Accreditation Guidelines were used as a guide to develop the plan and curriculum. So the population in the plan is long-term care nurses and long-term care facilities within a corporate setting. So 7 of the 13 corporate facilities associated with the corporation, the ones with a higher number of beds, so there's a higher number of nurses to be included in the residency program. With the intervention, there will be a residency program director at the corporate level. There will also be preceptors at each facility and a residents at each facility. The preceptors will receive a 1-day in-class training with 4 additional webinars. And the residents will receive 1 in-class and monthly webinars to address the curriculum. The webinars will help to address the barriers rather than having it all in class. The curriculum plan is focused on 13 CCNE guidelines for curriculum, which focus on patient safety, patient care, communication, professional development, cultural competence, performance improvement, also ethical decision making and stress management. Methods to achieve those include learning style and precepting style activities during the in-class days, and the case studies activities will be used through the webinars, as well as the residents performing monthly reflections on a topic. And going back up to talk about stakeholders, the stakeholders will include the CEO, CNO, CFO at the corporate level, as well as the administrators of each facility, of which the cost and plan will be discussed and approved by the stakeholders prior to implementation. Specifically, the Eckerson states that the average turnover per nurse is $88,000, including training and replacement costs, and Salmond also supports that recruitment, overtime, and agency use contribute to the cost. Limitations and barriers, according to Eckerson, are economic hardship, low response rate, voluntary participation that can make it difficult to implement the program. However, according to Cadmus, specific to long-term care is that one nurse is hired at a time rather than acute care where multiple nurses are hired at a time. And the stigma of long-term care can be a barrier as well, and that nurses use long-term care as a stepping stone to future career paths. The education of nurses in long-term care varies from LPN to BSN, which can make it difficult to educate them all at the same level. And then where the webinars come in is addresses the geographical and financial support to reduce travel costs to the corporate facility. The articles I reviewed didn't discuss any ethical or cultural aspects, so the ones that I came up with is the nurse culture and the nurse level of education that the residency programs would need to address specifically any culture assistance or specific level of education assistance the nurse may need. The outcomes supported by the research include nurse competence, nurse confidence, job satisfaction, and retention. However, with this plan, it will improve the retention rates in long-term care. The evaluation parameters the evaluations will be completed at 6 months, 1 year. The CCNE recommends the 1-year evaluation because that's when nurses develop the knowledge application to practice. So the goal of the program is to improve retention by 50% in the first year. Most of the articles that I've read stated that 80 to 90% improvement in a year in acute care. However, due to the limited number of nurses and various locations, I think that would be an unrealistic expectation to start with. So the evaluations will also occur on initiation and will include the geriatric institutional assessment profile that will test knowledge, attitudes, and perceptions to providing geriatric care. The Casey Fink Graduate Nurse Experience Survey will be performed as a Likert scale that assesses the comfort, confidence, and support the residents feel. And the modified preceptorship program evaluation tool will be used to assess preceptor and residency perceptions of the residency program. And that will be Likert scale as well. In addition to the evaluation tools for the program, to assess retention rates, each facility's human resources will assess and track their retention and turnover rates every month and submit it to the residency program director to be analyzed. For the conclusion, I just want to offer some statistics. Salmond states that 44.4% of RN turnover in the first year. RNs have turnover in the first year of employment in long-term care. According to Welding, 41% of BSN nurses are not prepared for patient care. Even though residency programs are going to cost to pay for training, the benefit of patient outcomes and improved retention will eventually improve the cost. There is no easy solution to residency programs or improving retention. However, residency programs are the best option to improve the transition for the nurse. Additional research is needed to continue to validate and support the research and results that long-term care residency programs improve retention and other outcomes. The result dissemination will be given to the stakeholders at 6 months and 12 months. And 6 months, the evaluation occurs to assist in the modifications of the residency program to improve it. Also, the dissemination will occur with digital posters at peer conferences and hopefully CCNE accreditation. The continuous evaluation will need to occur to help the residency program prepare the residents for the adapting to healthcare environments, healthcare changes, nurse profession changes, and practice changes. These are my references. Thank you for reviewing my presentation.